Assalamualaikum everyone, welcome back to this channel. So this is me Arya Wahid. In this video we are going to start the chapter of respiratory disorders in pharmacology. So in the previous lecture we have discussed about the asthma, about the drugs covering it, but now I am discussing the detail of its pathophysiology. So let us start it again. So first of all, let's discuss the definition of asthma. So it is the acute inflammatory condition. So it is a type of inflammation, and where the inflammation happens and what it is causing, such it is narrowing your airways, causing the bronchoconstriction. So it causes the episodes of bronchoconstriction. So this is called as asthma. So actually, it is causing the inflammation in your bronchioles, causing the constriction of the muscles which are present in the bronchioles. So, what happens when a patient has asthma? Symptoms of asthma are shortness of breath and dyspnea, tightness of chest, wheezing sounds are produced during the exhalation. Hyperventilation means the patient begins to breathe more and more, and his speech is decreased. He cannot speak more than one sentence in a single breath. So let's discuss this causative agent. So it is caused by a lot of agents like dust, pollen grains, perfumes, various kind of hairs, microbes, smoke, and hypersensitive person who are very sensitive, who are not exposed to microbes. When sudden they are exposed to the microorganism, they become hypersensitive and they will face a episode of asthma. And the patient who have genetic disposition mean the patients who have genetically disorder of asthma. So some childs are born who have genetically asthma in them, so they have lifetime asthma in them. Sometimes the asthma can be reversible. So the acute asthma is reversible. It can be treated down with the help of various kind of medication, but the chronic asthma cannot be reversible, so it will remains lifetime, and the patient have to take their drugs on time. So and there are also some drugs which are promoting the bronchoconstriction or causing the asthma to that patient, like aspirin and the beta blockers. So actually, why aspirin is causing the bronchoconstriction? So actually, the aspirin has some anti aspirin acid sensitivity, which is called as ASA. So actually it is an anti-inflammatory drug, but it also block the cyclooxygenase. And what is a cyclooxygenase? Cyclooxygenase is an enzyme which convert or which help in the production of prostaglandin, and prostaglandin is involved in causing the inflammation. So indirectly the aspirin is related to causing the inflammation inside the bronchioles, but outside it is acting as an anti-inflammatory agent, but it has some kind of inflammatory like properties in it. So you can say that it is an adverse effect of the aspirin drug. Now let's discuss the pathophysiology of asthma in detail. So here I have written the pathophysiology of air. First of all, the allergens, which is from outside, it can be a dust, it can be a pollen grain. They will enter into your respiratory system. Your immune system activate because they send some kind of foreign particle, and after that, the antigen representing cells move there, and they will attach the part of allergens to themselves like this. The allergen is attached to them. So what are the antigen representing cells? So actually they represent or they detect that a foreign particle which should not enter in our body, but it enters in our body. Now actually it is making a announcement to our body that some kind of foreign particles are entered. So now our body will activate itself and to prepare itself from fighting that particle. Now it also phagocyte that allergens in it, After the phagocytosis, it causes various kind of T cells to digest its own self. So actually it contain a receptor on it. This receptor is called MHC2 receptor. So this receptor expresses itself. Now the helper T cells which are present in your body, they will come and attach to this receptor site. And the T cells also has a receptor which is called TCR, T cell receptor. So this part attached to the this antigen representing cell, as I have explained here, this is a T cell and it attached to the antigen representing cell. After this attachment, there is a release of two chemicals. First is the interleukin 4 and second is the interleukin 5. Interleukin 4 is also causing a production of a mechanism of inflammation, and interleukin 5 is also causing an inflammation. Let's discuss the interleukin 5 first. So it activates the immune cells which are present in your body, eosinophils. They activating them, and after that they will cause the release of histamine, proteases and chromalin. Histamine, you know that it is attached itself to the histamine receptor, causing the inflammation. Various kind of proteases are also attached to it, which break down the protein of bronchial membrane. And chromalin accumulate various kind of immune cells around it, various kind of neutrophils, basophils. They will cause more and more inflammation here. It also acts as a chemotaxis, so it will cause the attractiveness of chemicals here and causing more and more inflammation, and also attract more eosinophils to that particular site. Now, after this, let's discuss the mechanism which is caused by interleukin 4. So, now interleukin 4 will causing the activation of your plasma cells, and you know very well that plasma cells are responsible for the production of an antibody. And which antibody? IgE. So IgE antibody will produce by the plasma cells, and these IgE antibody attach themselves to the mast cell. Mast cell, you know very well, they are really important in your respiratory tract. Like this is a mast cell. On this mast cell, this antibody IgE will attach itself, and after this attachment, the mast cell will burst out. And how it will burst out? Let's see this. So let's suppose this is the mast cell. Now it bursts again, and after this attachment of antibody, and it will cause the release of various kind of chemicals. Actually the chemicals present already inside this mast cell in the form of granules. Now when it bursts out, it will release all of these granules in the outside. And what these granules contain, I will explain them. So these granules actually contain the particles or the chemicals which are responsible for the causing of inflammation. Now three types of chemicals are present inside it. First is the histamines. Histamine is the one of the major cause of inflammation inside your bronchioles. So this histamine go and attach with the H2 receptor, histamine 2 receptors which are present in your bronchioles. They will attach to them, and after that they will cause the inflammation at the bronchioles. Second, the chemical which is released by this mast cell is the prostaglandin, and you know very well about the prostaglandin, its pathway. So it is actually produced by all the cell membranes. So arachidonic acid is present in your lipid bilayer. This arachidonic acid converts itself into the prostaglandin or leukotrienes with the help of various enzymes like cyclooxygenase and lipooxygenase. So they are produced, and whenever they are produced, they are increasing the vascular permeability and increase the inflammation. And leukotriene is a most important chemical which is actually produced by your WBCs, mean leukocytes, and they have very important role in the inflammation. So whenever these chemicals are released, they are responsible for causing the inflammation, and whenever the inflammation happens, the patient will undergo attack of a asthma. So after some time you see that the asthma patient is cured down. So why it happens? Because now again the concentration of histamine decreases, it will deattach to its receptor, and now what happens, the bronchioles dilate itself. So whenever the bronchioles dilate, the patient will become normal, but he has the inflammation inside itself, but is not visible. So it is giving it signs, but after some time the patient will become normal. Then after some time, whenever he exposed to the causative agent like dust, like polar grains, then again the episode of asthma will start it out. So this was all about the pathophysiology of asthma. So in the next lecture, we will discuss all the drugs which are used to treat the asthma. So majority anti-inflammatory drugs, bronchodilating drugs, and some stabilizer of mast cells. These drugs are used to cure it. So the drugs which are used for treating it will be discussed in the next lecture. So make sure if you have to subscribe this channel and also press the bell icon so in order to get the next video which I have uploaded. So thank you so much. Meet you soon in the next lecture. Till up, Allah Hafiz.